Hey guys, so I'm going to be teaching you all MeditMen this year, so we thought that it would be helpful if you had a video to go by like you had this summer, and you will have a video for the remainder of your skills this semester as well. So we're doing MeditMen with reconstitution. So today I will be giving a PO medication, a sub-Q medication, and an IM medication. So the way that we will begin checkoffs is it will be just like the summer. When you walk into the lab with your instructor, there will be a basket sitting on a table with armbands. You will select an armband based off the armband that you drew. You will select the correct patient chart. There will be multiple charts there, so be very careful that you get the chart that matches your patient's armband. So we're going to say that I've already done that. I'm in my room. I've gathered my supplies. So supplies that you need for this checkoff, you're going to have the patient armband, you're going to have your set of orders, MAR, and you're going to also have a set of labels, okay? You will pick up the labels before you come in as well. You're going to need to bring with you your drug guide. You're going to need a pair of gloves. You're going to need whichever medications you're given. If you end up having an elixir, you will need that water bottle. You will need PO pills in case you get a PO medication that's a pill. You're going to need a vial to draw up insulin from that's liquid. You will need your reconstitution powder vial. And then I have a second liquid to utilize for to differentiate between my insulin and my IM. You don't have to do that. You just need to make sure that you have at least one vial of liquid and your vial of powder. You also need medication cups. So if you're given a liquid medication, you need this type of plastic cup. If you get a pill, then you will use the little paper cups that you were given. I also have alcohol preps. I have my syringes. So you're going to see this as I go through the video, but you're going to need to bring your 3cc syringes, and I also would bring a 10cc or a 5 just in case to have an extra, but you definitely need two 3cc syringes. You need 2 insulin syringes, and then you need a needle to draw up your medicine with, to mix and draw up, and then a needle to switch to before you give it to your patient. A little tip and trick I like to teach my students is to utilize the opposite needle for the injection that you're given. So we're given an IM injection. I'm going to use an orange needle as my filter needle so that once I get ready to change my needle, this prompts me. I know I'm given an IM injection, so I need to change to a gray needle. All right. So I've got all my supplies, and now I am ready to tell my instructor to start my time. You will get 25 minutes for this medication administration checkoff. So Miss Brown, I'm ready to start my time. So the first thing I'm going to do is I've got my armband and I've got my patient's orders and MAR. I'm going to check the orders and the MAR over to see if there are any errors or any allergies. And I'm going to go ahead and be up front. There will be errors and there will be allergies. So be sure that you are looking through these with a fine-tooth comb, okay? So the first thing, my patient is Robert Harris. I'm going to check his date of birth and his ID. The next thing I'm looking for are allergies. This says that he is allergic to penicillin. So I'm going to be keeping that in the back of my mind as I go through and see what medications I'm given today. So the first thing I have is sliding scale Humulin R subcutaneous before meals and PRN for hyperglycemia. So now I'm going to compare that to my MAR. It says Humulin R subcutaneous before meals and PRN for hyperglycemia, and I have my sliding scale listed here. So whenever you come in the room, your instructor is going to write you a glucose down, and based off of the glucose on your armband, that is how much insulin you will give based off the sliding scale. So Miss Brown, what's my glucose today?
I'm going to say 320.
Okay, 320. I'm going to write that down so I have that. So now I'm going to proceed to check my MAR and my orders. Next, I have phenobarbital elixir, 60 milligrams PO every day for seizures. On the MAR, it says phenobarbital elixir, 60 milligrams PO twice daily for seizures. So there's an error, and you can see that I have circled it and highlighted it on my paper. I want you to do the same. The day of, you need to mark out what is incorrect on here so that you don't forget about it. So you learned in the summer, if we have an error on the MAR, but we have orders, we're going to go by what the order was written as, okay? So what I would do is I would tell my instructor that I'm going to have the pharmacist adapt this MAR to reflect the orders. If you had an error with the orders versus the MAR, you have to call the physician, okay? Because they're the only ones who can modify those orders. The next medication I have is oxacillin 500 milligrams IM every 6 hours for infection. On my MAR, it says oxacillin 500 milligrams IM every 6 hours for infection. So a red flag is already going off in my mind because oxacillin and penicillin sound a whole lot alike. So I know when I'm looking up my medication in my drug book, I'm going to be looking to see if there is a connection or contraindication between oxacillin and penicillin, okay? So the next thing I'm going to do is I'm going to go to my labels. You're going to have a set of labels, and I'm going to go ahead and star which 3 medications I'm giving so that I know I don't have to look at any other medicines on this form and I don't get confused. So my first one is insulin, and it's down here at the bottom, so I'm going to star my insulin, okay? You can circle it, highlight it, just make sure you have a way of noting it. My next one is phenobarbital, so I'm going to star it. And then my last one, my IV meds are on the very back. So I know it's oxacillin, so I'm going to mark oxacillin. And that way, that just saves me time and trouble. All right, so the next thing that I'm going to do is look up my meds in my drug guide, okay? We're going to go over this in depth in the classroom. I highly suggest filling out the drug guide worksheet that I give you because I'm leading you to water. You just have to drink it. You're going to see these meds again during checkoff. So you can see how I have my drugs all labeled here. That way, when I get here to check off, I'm nervous. I'm not fumbling through this book my whole time. I'm going exactly to what I need. And I'm also going to have you guys to highlight what's important to tell your instructor because we don't want you rambling on for days trying to figure out what's important. So let's get to the drug guide. I'm going to look at my insulin first. All right, so I'm to insulin in the drug guide, and I know that I'm given per my orders and more regular insulin. So what I need to know about regular insulin is it's a short-acting insulin. It has an onset of 30 minutes. It peaks within 2.5 to 5 hours. It's going to be given subcutaneously, and a contraindication would be hypoglycemia. How would I know that my patient's hypoglycemic? I've got to do a blood AccuCheck or a glucose check before I ever administer insulin. And I know that insulin is for hyperglycemia. And I also want to tell my instructor for this drug that there will be a meal readily available on the unit or in the room for my patient so that they don't get hypoglycemic. We never administer insulin without having access to a snack of some sort. Okay, so now I'm going to move on to my next drug, and it is phenobarbital. All right, so here's phenobarbital. I already have it marked, everything highlighted that's important. Phenobarbital is for seizures or epilepsy. It's contraindicated in people who are pregnant, breastfeeding, or have a hypersensitivity. But my patient is a male, so I don't have to worry about those contraindications. The biggest adverse effects of this drug are central nervous system. So it significantly impacts the central nervous system. So a nursing assessment prior to giving this medication would be to assess my patient's level of consciousness. I want to know, are they awake, alert? And that way I know once I give this medicine if there is a change. You always want a baseline assessment. Okay, I also want to teach my patient they're not going to drink alcohol with this drug because it can increase the effects. And I also want to teach them that if they combine this drug with anticoagulants or central nervous system depressants, it can interfere with the medication. So the biggest assessment for this is going to be mental status and then respiratory status. You can remember that for any drug that affects the central nervous system, it can affect our mental status and it can affect our respiratory status. So Miss Brown is telling me I'm good. I've told her enough information on that drug. So now I'm moving on to my antibiotic. All right, so oxacillin is an antibiotic. Antibiotics are used to treat infections. The first thing I'm seeing under contraindications is hypersensitivity to this product or penicillins or cephalosporins. So my patient would not be allowed to receive this medication. So if you get in this position during checkoffs, you would pause there. You would tell your instructor, my patient has an allergy to this medication. I would need to notify the doctor and probably get an order for something else. For checkoff purposes, we just want to know that you know to contact the physician. And after you identify that allergy alert, we're going to allow you to proceed and administer this medication for time purposes. Okay, the only other thing for antibiotics is super important is that they can cause a lot of GI side effects, so diarrhea, nausea, vomiting, and then I'm going to tell my patient to let me know anytime I'm starting a new antibiotic. If you have a rash, itching, hives, any symptoms of an allergic reaction, you need to press the call light and notify me immediately. Miss Brown is telling me that I am good to go with my information from the drug book. So now I'm back over here and I am ready to prepare my medications. I'm just going to start at the top and I'm going to do insulin first. I'm going to have my insulin syringe. I've done hand hygiene and I'm going to put gloves on. I'll put it on for y'all. All right, so the first thing I got to do, this looks like a multi-dose vial. So I am going to have to clean it. I'm going to move this over so I don't get it wet with medicine. I'm going to clean my vial. I'm going to get my insulin syringe ready. I'm going to take the cap off. And Miss Brown gave me a glucose of 320. Based off of my sliding scale, I have to give 10 units of insulin, okay? So first I'm going to draw up 10 units of air. I'm going to inject that into my vial that I've just cleaned. Now I'm going to draw up 10 units of insulin. And I'm making sure before I draw up that I've checked my vial, which for these purposes, we're going to check the label because that is what's the actual insulin and that this is indeed insulin, okay? Humulin R, that's what my order is for. All right? So I'm going to go ahead and do my first med check on this, and I'm going to say that I have 10 units of insulin. 10 units of insulin, that's correct. I'm going to set it to the side. All right, the next thing on my list is phenobarbital. I have a liquid elixir, so I'm going to check it. When I pull it, make sure it's the right thing. This is phenobarbital, and I'm looking at my label, and it's 20 milligrams per 5 mLs. I need 60 milligrams, so I'm going to do the math. That's 15 mLs. We know for a liquid, we put it in the palm, the label on the palm side of our hand. I'm going to get at eye level, and I am going to pour 15 mLs. Okay, and I've got 15 mLs. I'm going to do that med check. I'm going to say I have phenobarbital, 60 milligrams, which equals 15 mLs. I'm going to label that, and I'm going to set it to the side. Okay, the next thing is our IM. This is new, okay? So this is a reconstitution. So I'm going to show you how we do that. I'm going to flip to my label that tells me all about my antibiotic. And I'm going to teach you about this a lot in class. But on your antibiotic, we're looking for two different things. So first, we have to reconstitute. We have to turn this powder into a liquid. So how do we do that? This sentence here that says add 2.7 mLs of sterile water or normal saline for injection, okay? That's all I'm looking for right this minute is what I need to utilize to make this powder into my liquid. So I'm going to go ahead. I'm going to get this ready. We're going to say this is a clean alcohol. I'm going to clean this vial. I'm going to get my 3 cc is good because I'm drawing up 2.7. I'm going to connect this without contaminating. I'm going to draw up 2.7 of air, but I'm not going to do that much right now because my vial has so much pressure in it already. I'm going to inject my air, and then I'm going to draw back 2.7 mLs of, this is just normal saline, and my label said that it was acceptable to utilize this as a diluent. All right, I'm still drawing back till I get to 2.7. I'm almost there. All right. So now, I think I need a little bit more. I'm going to pull out, and I'm going to make sure that I'm at 2.7. All right. So you can see that I am at 2.7. At this point, once I've checked it, I know I have the correct reconstitution amount. I'm going to look back at my label. I'm going to scoop my needle, and I'm supposed to have 2.7. At this point, I would hand this syringe over to my instructor, okay? So my instructor takes that syringe. That's my final answer for my reconstitution amount. Okay, next, we are going to hand you back a syringe that has liquid in it for you to inject into your powder. So I'm going to get Miss Brown to pass me a new syringe that has my liquid in it, because now I have to dissolve my diluent. I'm going to clean this. I've got 2.7. That's what it said to have. I'm going to inject this into this vial, and there's a lot of pressure. Just beware. That's normal. Okay, now I'm gonna scoop my needle. Okay, and then now I have liquid in the powder. To mix it up, we're then going to roll it in our hands like this. Okay, you don't want to shake it vigorously. You just want to roll it like this until you're mixed enough. You can turn it back and forth a little bit. We just don't want to do any vigorous shaking. So I'm rolling it, I'm tilting it. And what we're looking for is for all the powder to be gone, okay? So now I can see I have all liquid, no powder. That's what I want. Now I'm back to my antibiotic label. The next number that I'm looking at is what actual dose of medicine am I going to give out of what I just mixed up. My label says that 1.4 mLs contains 500 milligrams of oxacillin. So I'm going to flip back to my order, and it says 500 milligrams of oxacillin every 6 hours for infection. So that's an easy math there. I know that I'm just giving 1.4 ml. So now that's what I'm going to draw up. You can use the same needle to draw up your medicines the whole time for reconstitution and once you actually have your medicine mixed. You do not have to change your needle until before you administer to the patient, okay? So you only have to change your needle once. So I'm going to go ahead and draw up 1.4 of air because that's how much medicine I need. I can clean this off again. I'm going to inject my air. I'm going to draw up my 1.4, and this needle's little, so it takes a minute to draw up what you need. Make sure you always stay below the level of the fluid. All right, and I can see that I have what I need. I'm going to scoop. Do not recap your needles. All right, I'm going to double, triple check this. That is 1.4. I'm going to do my med check on it. So I'm going to look at my label. I have oxacillin 1.4 mLs, which equals 500 milligrams, and that's what my order is for. Now I'm going to label this medication so I know what it is before I leave the room, and I'm going to do a second thorough med check over my meds before I leave the med room. So I'm going to start with my insulin. I'm going to find that label, and I have Humulin R. This is 10 units, and that's what my order is for. That is correct. Okay, I also have potassium chloride elixir, 20 milligrams per 5. That's 60, which equals 15. That is correct. I'm going to set it to the side. And then I have my IM medication. It is oxacillin, 500 milligrams, which equals 1.4 mLs. And that is correct. I'm going to set it to the side. Now I would do hand hygiene, wash my hands, change my gloves. I'm ready to go in the patient's room. All right. So now we're coming into the patient's room. Knock, knock, knock. Hello, Mr. Harris. My name is Caitlin, and I'm going to be your nurse today. Do you mind if I check your name and date of birth on your armband? We want you to actually put the armband on the patient, so you do not forget to do this. This is Robert Harris, and I'm checking it against my MAR. Date of birth 4/11/19XX, and he is allergic to penicillin. Mr. Harris, is that correct? You're allergic to penicillin? He tells me yes. I'm going to say I already spoke with the doctor and it's acceptable to proceed, okay? So now I am ready. I'm going to do hand hygiene, put new gloves on once I get in the room. I'm ready to do my third med check on my medicines. So my oral, I have 15 mLs of KCL elixir. I'm going to be looking at my label. That is correct. It's 20 per 5. Sorry, phenobarbital. Excuse me if I said the wrong medicine. Phenobarbital is what I'm checking, not KCL. It's phenobarbital. Okay, and then also insulin. So I have 10 units of regular insulin, 10 units of regular insulin. And then my antibiotic, I have oxacillin. I have 1.4 mLs, which equals 500 milligrams, and that is correct, okay? So now at this point, I've done my third med check. It's my final answer. I'm going to hand in my insulin syringe and my IM syringes to Miss Brown, my instructor, and she's going to pass back some empty syringes. So I now have an empty syringe. I'm going to pull up 10 units of air to give my insulin for my sub-Q, and I'm going to change my needle on this one. You can change it before you hand it in. We just need you to know that you change your needle before you give the patient the injection. And I'm going to just drop some air to do my IM injection because I've already checked everything, okay? So now I'm going to sit my patient up. I'm going to start with the PO just because it's the easiest. Make sure you have something to drink at the bedside. I've got my phenobarbital. I'm going to have my patient sit up. I'm going to have him swallow this medicine. He did great. He did fine. And now I'm going to tell him I'm going to proceed to your sub-Q injection. I'm going to raise this bed up to working height for me. All right, so I'm going to look on my MAR. I'm going to see this patient weighs 178 pounds, but he's pretty tall, so I'm just going to go in at a 45-degree angle. So I've got my empty insulin syringe ready. I've got my alcohol pad. So I'm going to go ahead. I'm going to clean it. I'm going to get my needle ready. And this one is old and likes the safety. I'm going to remove this. I'm going to pinch up. I'm going to go in at a 45-degree angle, little stick, inject my medicine out, safety my needle immediately. All right. And then now we're ready for your IM injection, Mr. Harris. So I'm going to tell him to roll over onto his side. The landmarks I'm looking for are the greater trochanter. I do like this, thumb towards the groin, pointer finger towards the belly button. All right, I'm going to go ahead and mark my site while I'm getting my stuff ready. I've got a Band-Aid on. So first, I have to Z-track first, okay? And then I'm going to clean my site. And then I'm going to get my needle ready. I'm going to say a big stick at 90 degrees. All right, I'm going to aspirate. There's no blood. I'm going to inject slowly for 10 to 20 seconds. All right, I'm going to take it out, safety my needle immediately, put my Band-Aid on, roll my patient back over. I'm going to lower the bed back to the lowest position. I'm going to ask him if he needs anything, leave his call light in reach, and tell him that I will be back to check on him in 20 to 30 minutes. My disclosure for this video is I'm very sorry that I said KCL when I meant phenobarbital, okay? The elixir was phenobarbital, but that goes to show you can get mixed up very easily, so make sure you are checking and you are saying the right medicines. That's why it's very important to check your labels and make sure that you are saying and doing the correct things. But that's all.
And you have 2 minutes to spare, so you have passed the check off.
Woohoo!